Hi, I'm Charmaine, and I'm representing patients, Australian patients, via the Autoimmune Community Dragonclaw Limited.
I'm Maya, and I'm representing the Australian research organization, Community and Patient Preference Research, or CaPPRe for short.
So, several of us in Dragonclaw noted on social groups that there seemed to be a lot of patients who were not optimally controlled. And we were surprised about that with the new medications, biologics, and JAK inhibitors that are now available. So, we wondered why.
So, CaPPRe and Dragonclaw worked together to conduct a study with 146 Australians living with different types of chronic inflammatory diseases. We co designed the research, so it was a collaborative process from conception to dissemination of results. The funding proposal was developed collaboratively, and CaPPRe drafted study materials, while the Dragonclaw research team thoroughly reviewed every single piece of research material to ensure it was relevant and meaningful to the patient community. Part of the co-design process also involved research training for the Dragonclaw team, so they could learn about the main methodology we were using, discrete choice experiments. This allowed them to be active participants in decision-making about the study design. The majority of participant recruitment was also facilitated by Dragonclaw through their community partnerships. Our key findings highlighted a gap in treatment awareness and the importance of shared decision-making. I think a key strength of this partnership was in communicating research findings for the highest impact. So CaPPRe took lead on communicating findings to the academic community through submitting conference abstracts.
And Dragonclaw took responsibility for sharing the findings with the patient community. We organized a webinar, had 77 registrants. Maya went over the findings, and then I went over the significance of the findings. This webinar was taped, and we'll be sharing the tape widely with patient organizations throughout Australia.
In terms of what was learned through the process about partnering effectively, we learned that successful partnerships require time and commitment from both sides. Our experience highlighted how important it is to leverage patient knowledge in every phase of the project, not only because it is the right thing to do, but it makes the research stronger. Our experience reinforced that patient partnerships enhance the relevance and the impact of research.
And we patients, we learn the value of working with a research team such as CaPPRe. It enables the patient voice to be heard. The research validates patients' perspectives, and patients do bring different knowledge to any research project, knowledge from lived experience.
And we also wanted to say a quick thank you to everybody involved in the